Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Does sitting contribute to back pain? That's something I hear about all the time in my office. People ask me this all the time. I sit a lot. That's one reason I have back pain. Well, a major manufacturer of workstations reports that 86% of work computer users have to sit all day, and when they do get up from sitting, more than half use food as the excuse to get up and move. In addition to sitting at work for meals and commuting to or from work, 36% sit another 1 or 2 hours watching TV, 10% sit 1 or 2 hours for gaming, 25% sit 1 or 2 hours for reading or lounging around, and 29% use their home computer for 1 or 2 hours. So basically the average American sits for 13 hours a day and sleeps for 8 hours. That's a total of 21 hours a day off their feet. So that's a huge factor, definitely in people's lives, and contributes to a whole bunch of issues. So what about the low back and sitting? Well, you guessed it, sitting is hard on the back. The pressure inside of our discs, those shock absorbers between the vertebrae that lie there in our spine, 22 discs in total, is higher when we sit down compared with simply standing or lying down. And when we lay down, the pressure on our discs is the lowest at 25 millimeters. When lying on one side, it increases to 75 millimeters. And then standing increases disc pressure to 100 millimeters. And bending over from standing pushes the disc pressure to 220 millimeters. When we sit with good posture, our disc pressure may reach 140 millimeters, but that can increase to 190 millimeters with poor posture. So to help relieve the pressure on our discs, experts generally recommend get up periodically and stand, and then sit back in your chair and avoid slouched positions. Place a lumbar roll about the size of your forearm behind the low back and the car seat as well as your work chair, and then changing your position frequently when sitting, because certain low back conditions favor one position over another. These rules may need to be modified and changed. For example, most herniated disc patients prefer low back extension while bending over or slouching if that hurts. And in those with lumbar sprains and strains, bending forward usually feels good and extension hurts. So modify your position to one that's most comfortable, and that's a good rule of thumb. And if you have low back pain, or you've been sitting a lot, you sit a lot to your job during the day, definitely get yourself checked chiropractically, and we'll be more than happy to help you with that. Just check us out at newhopechiropractic.com and set up an appointment through the website. We'll be sure to help you as soon as possible. Have a healthy day.